So we chose the topic of compassionate leadership for a number of reasons, and recently we've had some both anecdotal feedback but also feedback through the staff friends and family test survey. So we have had more feedback during the survey that we did in August, when we know the hospital was really busy, where people's perception was that that at the top of the organisation we didn't understand the impact that was having on our frontline staff. So we felt it was really important that we reflected on that, and we reflected on what are the behaviours as leaders that we need to show that do demonstrate that we both understand and empathise with people when we're under pressure. At the beginning of the session, we watched two very powerful videos, both which helped us to understand a little bit more about what compassionate leadership means, and about, if we are compassionate, the impact that has on both our colleagues but also ultimately on the patient care that we give. One of the videos that we watched, and the links will be available for you to watch, is a clip from a presentation from Michael West, who is the Professor of Thought Leadership at the King's Fund. And he talks very well about the impact that compassionate leadership has on the patient, and identifies four key themes. The first is around paying attention and listening to others with intent. I think that's really, really powerful a conversation about how do you make sure that you are listening properly and that you're thinking about the things that people are telling you. And there is evidence to show that the more senior we get, the less we listen to our staff, which actually, given that we're so far away, removed from the shop floor, it's quite clear that we need to think about how we do that better. The second is then having a shared understanding about what's going on, and some of the feedback that we'd have from staff is that they don't always feel like we have got that shared understanding about the pressures. The third point he made was around empathising, feeling how it is to be in people's situation. And the final thing is then about taking some action, so to help them to resolve some of the issues that they're dealing with. We then talked about the fact that if we are going to demonstrate compassionate leadership, we can't do that if we're not visible. So what is it that we need to do in the organisation that makes people feel that we are listening and that we are paying attention and understanding and that we are taking action? So I asked Team Brief to think about some of those definitions and the impact that they have on how we are at work, and to take some questions to the tables and discuss how it actually feels in reality. And Heather's going to feed back some of the themes that came out of those discussions.